Throughout your placement experiences, you are going to have to work and learn with different teams to demonstrate a breadth of understanding of the wider health and social care system. So today I'm going to give you 5 example teams that you can easily hunt out to get your skills and competencies signed off whilst on placement, and give you little nuggets of information that you could easily turn into objectives when working with these teams. As a registered children's nurse, I have supported hundreds of students in practice develop their knowledge and skills to become highly competent practitioners through the method of spoking out into these different team areas, all of which being highly relevant to the placement setting that student is in. And within each example I give you, I will also provide you with an essence of their work to help you scope out any of those skills and competencies that you may need signing off, as well as any objectives that you may have set too. Let's start with psychologists, or the psychology team. So working with psychologists, you are really going to focus on your communication skills, your listening skills, in effect your ability to develop a nurse-patient relationship. And let's be real, any relationship building skills, be that within a clinical setting or in your personal life. And if you've not yet worked within the psychology services or worked alongside the clinical psychologist that's on your placement area, one of the things that you are really going to notice is their bedside manner. Now, commonly referred to as bedside manner, this is the way that you communicate with and care for patients, which ultimately impacts on the patient's mental state and overall sense of well-being. Nurses who can provide compassionate care to the most challenging patients have the ability to empathise with patients. So there is a major importance of psychology within the nursing profession. So it's simple to say that successful nurses build strong relationships with their patients, and we use psychology to develop this rapport. Because of psychology, nurses are often instrumental in things like getting their patients to take their medications when they really don't want to, or calming them down before a procedure like insertion of a cannula. Nurses who study psychology extensively are trained to understand a wide range and depth of emotions and what those emotions can cause in an ill or injured patient. Likewise, psychologists are able to determine whether or not the emotional state of the patient is what's causing their physical problems. And nurses almost use psychology on themselves as well, as nurses can work through unthinkable amounts of stress as they attempt to navigate through that patient's journey with all of their emotions and get down to the root cause of any problem effectively. Without psychology and nursing careers coming together, I think you can appreciate that it would be hard to carry out a nursing role. You will have within your assessment documents skills and competencies to achieve for things like communication within teams, communication with your patients, and the ability to build robust patient relationships to achieve the ultimate care for those patients. So have a flick through and see which skills and competencies you might get signed off by really working and learning with a psychologist in your clinical area. Now, sticking with this theme, let's have a think about the chaplaincy service. Chaplains are incredible, and not just for those people who would classify themselves as spiritual. Now, clearly, as a nurse working with patients, we must take their spiritual needs into consideration. So again, by going through your assessment document, you will be able to find skills and competencies to do with the spiritual care of our patients. By working with a chaplaincy team, you are definitely going to immerse yourself within the holistic care and needs of our patients. Now, it probably goes without saying, but by caring for the whole patient, that means physically, mentally, emotionally, and spiritually, nurses have to collaborate with other departments and teams. And to ensure that a patient's spiritual needs are met, nurses do work with chaplains and pastoral care services to provide a neutral, reflective presence while practicing the art of deep listening skills. And I think you can all agree that that's definitely something as nurses we must develop. Now, a lot of the time, our patients have questions about life, especially if they're going through life-altering surgery or treatment, or they find themselves in a position where they may have big life questions. And it must be said, when we're caring for patients going through end-of-life care, patients that may have not previously been spiritual may call upon the presence of a chaplain to sit and listen to some of those questions about life and any of their wonders about death. Again, this brings in the practice of psychology, linking in how illness and disease can change a patient's mental state. Chaplains can help hold a sacred space for anyone who needs it, and that includes you as learners in practice. practice, patients are going through stressful times, leading them to ask questions about life. So any of your skills or competencies or objectives that relate to holistic care, especially the spiritual needs of our patients, by scouting out the chaplaincy service, you are definitely going to get a great exposure to the care that they provide. Now, this third example requires you hunting out where the laboratories are located within the hospital you are in. Now, often when people think about the laboratories or labs, what often springs to mind is blood. So, by scouting out learning opportunities within the labs, you can start to learn the whole process from a professional taking a blood sample from your patient right the way up to aftercare following the release of the results of that blood sample. Now, depending on what the blood test is or the sample that's being sent and what the results show, you will be able to gain a greater understanding of the treatment pathway for our patients. And through this process, you may be able to develop the ability to answer some of the questions from our patients in terms of why the treatment pathway is changing, rather than just the blood results show that we can now stop this medication. Further teams within the labs will give you an in-depth snapshot of the world of bugs, and an example could be microbiology. Microbiology is the study of organisms, bacterial, viral, fungal and parasitic, which can cause infections. More often than not, the staff that work within a microbiology service are healthcare scientists, and a large part of their work will be the identification and classification of these organisms. And through this process, they will be able to identify and provide advice on the most effective drugs to use for treatment. Examples of clinically important organisms include one of the most famous ones, which is methicillin-resistant Staphylococcus aureus, which is known as MRSA, Clostridium difficile, or C. diff. We like to shorten these long ones, and things like norovirus. So if you're lucky enough to get a placement learning opportunity within the lab settings, you are definitely going to be able to geek out over these organisms and develop a deeper, truer sense of how infections are both identified as well as the treatment plan created. So you will be able to go back to your patients and give a bit more of a detailed understanding and explanation of the infection they may have and the treatment that then is made for them specifically. With a greater understanding of that infection, I'm pretty sure you're going to gain great respect for the treatment plan for that patient and the rigour in which patients need to stick to the treatment plan identified. Again, you are always going to find either skills or competencies in which you're going to need to demonstrate an understanding of infections within your patient group, and clearly, more importantly, the prevention of those infections as well. So by hunting out these learning opportunities within the labs or the infection control settings, you're clearly going to have a greater respect for those roles in healthcare. Pharmacy. And I say this one like this because any learner in clinical practice has probably spent, more often than not, half of their placement time in pharmacy. And this is often because you are the easiest pair of hands as a learner to be released from the ward area to go and collect prescriptions to bring them back up to the ward for our patients. However, I don't think that's enough learning, so let's look at what you could learn from having a learning opportunity based within a pharmacy setting. So clearly you are going to learn a lot about drugs, bringing your classroom pharmaceutical knowledge into practice. But as I'm sure you can appreciate, each professional group has their own slightly different slants on professional conversations. So you are really going to learn a lot about the communication within a pharmacy setting. You may also learn how to interpret prescriptions and witness the process of dispensing medications. But as we all struggle with this, you could specifically spend your time learning about drug calculations. Pharmacists will have their very own unique ways of working out medication dosages, so why not tap into their brains and see how they do it? More often than not, students want to have an objective that may be around learning one or two quite important and routine medications in that clinical setting. So if this is something like morphine or paracetamol or an antibiotic, you clearly have the opportunity to develop a greater understanding of those medications within that pharmaceutical setting. And by gaining greater pharmacological knowledge, you can help pass that on to your patients, giving them a greater understanding of the medications that they are being given. Working with medications is pretty central to what we do. So taking the opportunity while you are a learner to go and scout out how they do things in pharmacy will give you great exposure to that process. And the last example I want to talk about is social work, which sometimes gets incorporated within safeguarding services, or safeguarding sometimes sits within the social social work services. Now, I think I may have given you this example before, but as an oncology nurse, every patient that was admitted to our services were automatically assigned a social worker. And it was only really within this role as an oncology nurse that I truly developed a deeper understanding of what social work does. All of our patients were provided a social worker because, yes, they get their clinical care and treatment within a hospital setting, but we do discharge them eventually. And if that environment that we are discharging them into wasn't safe for them, i.e. their house may have mold in it, or a child with no immune system is sharing a room with their older or younger sibling, the social worker will play a key part in being able to rehouse that family or enhance the living arrangements for them. Now, I had no idea that work was happening, and it was only through spending time with the social workers as a new nurse within an oncology setting that I was exposed to that side of their role. By working with social workers, you are going to learn about compassion, humanity, how to make sure that people feel respected and listened to, as well as learning about the social model of disability from disabled people, and how to think about disability differently to just that clinical setting, as we know that social workers work within a clinical setting, but also the community setting too. By working with social workers, you are going to be able to build an understanding of the crucial role they play in supporting people to live their lives the way that they want to. And I end on social work being a great example of a team to go and shadow, because this truly is person-centered care. And we know that nursing practice is all about person-centered care. So I'm very hopeful the next time you have learning opportunities to develop, you're going to gain so much more than just seeing how that role works within a healthcare setting. Dig deeper, tap into things like holistic and spiritual care, and utilize these learning opportunities more wisely. Until next time, take care and stay safe.